All right. So this is our third and final health session within the World Women Foundation 2-day sessions. And today, these amazing women are going to talk about unlocking the power of information to advance the health of women. And I think, as we've been talking a lot, I'm thinking about our conversations, there is so much misinformation and disinformation and lack of information for women today. And it's really, really important that we can kind of cut through all that clutter and really figure out how to make sure we get the right information in front of the right women. So these are the brilliant women who are going to talk about how. So I'm going to let them go down the line and introduce themselves. Nichole Hutton, who is the Chief Client and Growth Officer for Burson, will lead us in moderating. But why don't we start with you, Jess, and then work our way down here.
Hello. Hi, I'm Jessica Califf. I lead the health team at Reddit, working closely with all these fine people up here.
Hi, everyone. Nichole Davies, Global Chief Strategy Officer for VML Health. Really happy to be here.
Super happy to be here as well. This is Burcak. I'm working for Bayer. I'm the Global Lead Reproductive Health. Very nice to see you all.
And I'm Nichole Hutton, and thank you for joining us this afternoon for what I know will be a really fascinating but really important conversation, because as Wendy has just said, I think it's still a really alarming surprise to many that women continue to find it difficult to get the right information at the right time about their healthcare. So I'm really delighted to be joined by these three fabulous women. We're going to start with Reddit. Jess, Reddit is here in a very big way, which I think is wonderful. And so I'm sure some people in the audience may be a little familiar with Reddit. Hands up if you've been on the platform. Okay, there you go. There you go. But you do a lot of, I think, really important work to moderate conversations, especially around topics like healthcare. Maybe you can give us just a quick overview of what you do and the importance of what you do.
Yes, absolutely. So for anyone who might not be familiar with Reddit, we are a social platform where every single user is completely anonymous. So I'm not Jessica, I'm user XYZ. And the platform is organized into hundreds of thousands of communities based on topics. So topics such as, arts, hobbies, movies, health, beauty, anything that you can name. And we have over 700 communities that are dedicated directly to health. And what makes these health communities so incredibly valuable is that it's a really safe haven due to the anonymity, right? You're not going to go on a public-facing platform and say, I'm dealing with this health ailment, or I have, this really private thing going on. But on Reddit, you can go to a community and you can ask a really vulnerable question about your health in a community that's full of people who care deeply about that topic. So for example, if you're dealing with fibroids, right, you're not going to be engaging in a subreddit about fibroids if that's not a meaningful topic to you. So when you're in that community, you are surrounded by like-minded, trustworthy people who can offer you a ton of guidance and support. We have actually done research relating to women's health this year that found that over 80% of the women polled said they actually feel less alone as a result of the communities, to your point, that it's so hard to get health care, it's hard to find health information. So patients are really empowered, and they're finding this information themselves. They're finding communities full of people who understand it. And the moderation is really important, especially in health. So every single community has really productive conversations because there is a group of volunteer Redditors who are choosing to moderate the community and ensure they are productive conversations. So these are volunteers who say, I care so deeply about menopause that I'm going to create a community and I'm going to set guidelines and rules that people must follow in order to engage at all. And then they enforce the rules. So this just ensures that it's really productive. Many of the rules relate to no bullying, like be supportive, be kind. And we find it's an incredibly kind and supportive space for that reason.
And do you find that that helps you filter out the misinformation?
Yes, absolutely. So the moderators are uniquely human, right? In this AI world, these are human beings who are experts in their field in many instances. So the moderators for our science and our medical related communities are literally healthcare professionals or academics or researchers. And it's such a good question. Like if you go to r/women's health, which has 150,000 people, there's a list of rules in order to engage in the community at all. And rule number 2 is please report misinformation and harmful medical information. And in addition, please source your information. So there are multiple layers where the community is moderating, the experts behind it are moderating, and then we have all of our company layers to ensure that we're combating misinformation.
I love that. Nichole, maybe we can switch to the role of brands. Yeah. I think it's super important for brands to play an important role in providing timely information to women. I know this is something very dear to your heart and certainly something that you've partnered with many clients with, and we'll talk about one specifically in a minute. But I guess at a macro level, why should brands lean into the conversation?
Yeah, it's a great question. I think one of the most sobering statistics that I saw recently from a recent study was 72% of women's health content in social media is either unverified or misleading, which is really a frightening number. So I think that just really underlines the challenge that we're facing. And then when you dig into specific women's health issues, the statistics are equally sobering. So things like 1/3 of women with heavy menstrual bleeding do not seek help from a healthcare professional, even though there are treatable options for the condition. And that's due to stigma and shame. And then things like for the menopause, 45% of women who are suffering menopause symptoms don't understand that they're menopause related. So there is an enormous amount of work to be done. And I'm just sharing a couple of statistics. I could speak about them all day. And I think that lots of different stakeholders play a role in supporting an improvement for women to get educated, to get empowered, to take ownership of their health. But I think brands in general have a really wonderful opportunity because I think the misinformation and the lack of information is really underlining there's a gap. There's a gap, and therefore there's an opportunity for brands to step in and play a trusted role in helping support women throughout all of their life stages in health, through education, but also connection. And I think when we talk about creativity, because that's obviously why we're here this week, I think creativity can really help connect with women in different ways, in personalized ways, to help them see themselves in the issues and challenges and understand they're not alone. This isn't something I just need to suffer in silence and get on with because it's just part of being a woman. This is something I can actively understand better, appreciate when it's not normal for me, and then seek out the guidance that I need to go and seek support for better outcomes. And I think that's where Bayer has really stepped up and has seen this opportunity and this gap in the market globally and is really putting a huge investment and commitment into improving the landscape for women's health education. And we have a video to play, of course.
We do have a video to play.
So this has been a labor of love for the teams, and we've had a really enjoyable time doing this because we're both very passionate about this issue. And I think when you pour your passion into the work, it really shows. So we're really delighted to show the Anything But Normal Bayer campaign.
And this is a new campaign that's just been launched.
Yes.
And when we were talking earlier, maybe just quickly before we show the video, you said something I thought really alarming but interesting around how women all around the world actually feel very alone when it comes to their healthcare.
Yes.
And I can't wait to see the campaign because I think the power of storytelling and ensuring that women, no matter where they are, no matter what their age is, no matter where they live, this feeling of connection, I think, is super important in providing a safe place for women to lean into to get the information that they need.
Absolutely. And I think information that's tailored to their individual challenges makes it all the more personal. And I think building communities and bringing, as you say, people together in a trusted place, like places like Reddit and platforms that brands can build, I think just helps people feel, okay, this is not just me on my own struggling with things that I just need to keep together and keep going on. And there are other women like me, and actually they've been on similar journeys, and there's things I can actually do to help improve my health outcomes.
All right, well, with that, I think we will show the film.
Every single month, blood. So much blood. The lost moments, the sacrifices I've made. Is this heavy period normal?
I've been told it's common in menopause, but my whole body's on fire. Dripping sweat. The sleepless nights, ups and downs. Is it normal I suffer in silence?
The desire's gone, vanished. The growing distance, feeling sad, guilty. Is this quiet?
Love a tech fail.
Whoa.
That's not part of the campaign.
Well, look, while we're getting it set up again, goodness, that's impressive. Burcak, when we were talking before, you, I think, made a really important point around, yes, your brand is playing a really important part of this conversation, but you're not doing this alone. And core to the strategy for you was to think about an ecosystem of stakeholders that you need to be able to tell this story effectively. Maybe you could talk a little bit about how did you select those stakeholders? Why did you choose the ones that you chose? And how do you create that trusted ecosystem?
Sure, but maybe before going to the stakeholders, a little bit about the campaign itself, if I may. Yeah, okay. The secret is afterwards. Okay. I mean, just a little bit maybe. I mean, we want to really change the status, correct? Is it coming? Okay. Okay. Let's first then.
Keep going back. Back way. It's the heat, I think.
Thank you.
All right.
Okay. Here we go. No, it's yeah. It's,
I'm sure that's close enough.
We just need it on play now.
yeah. Can we have the sound?
Oy.
Let's get the
Anyway, yeah. So, Burcak, tell us about the campaign.
Okay, a little bit about the campaign and then the stakeholders, if I may. So, about, as Nichole very nicely said, I mean, there is a big job to be done in this space, right? Because, as we said, like, woman is underserved, suffering in silence, and she is not aware even that she suffers. For her, it's the normal, because she is believing as if it's just being part of being woman. She suffers from menopause, she suffers from perimenopause, she's having menstrual bleeding. With the facts we had seen, there are many different women's healthcare issues that she suffers, but she's just accepting suffering, which is the tension that we are touching with this campaign, though. We say, like, I mean, as you had seen at the very beginning, the numbers are almost 50% of women globally has women's healthcare issues. More than 55% does not do anything and don't seek any treatment. So the problem is huge, and there is sort of a big job to be done in that sense. That's why, and that's how this campaign was born, though. This is anything but normal. We say if you suffer from anything that holds you back, if it enables you not to live as is on your top, if you need to sacrifice from your quality of life, go and act on it. So this campaign is all about a call to understand, call to question your normal, your perceived normal, and call to act on it. So this is about the campaign itself, that we are feeling super
Proud
excited
and
for
excited,
that.
yeah.
But this is just the beginning. As you very well said, this is just a campaign. It's just like, first, step in the journey. There is a big job to be done. And our vision as Bayer, as one of the key stakeholders in this pharma ecosystem, We would like to empower women in a way with knowledge. We want to educate women with the comprehensive knowledge. We want them to understand their body. We want them to understand health. We want them to demand the care they need and have the access to the care that they are required. So this is basically the ambition. This is the vision that we are aiming. Of course, we are not alone, and we cannot do it only us in this journey, as we were well said. We need to do it holistically. It's a collaborative effect, a collaborative work. Who are those? I mean, first of all, the woman. I mean, it's not only women's problem. It's also the problem of men, right? The partners, the caregivers. So that is basically one of the key stakeholders that we need to also educate men, educate the caregivers to make sure that we complete the mission. And then the other piece is the healthcare professionals, right? We are seeing still some eye-opening numbers that also healthcare, I mean, doctors are not really on top of the stuff. Like, they are not, for example, menopause, right? It's the hot topic nowadays. 40% of the cases is not well understood by the doctors. So it's a big number, right? And it's menopause is the thing of the century. So, and then when you look at it in the HCPs, what we expect is in this journey, we want them to provide the education, we want them to provide the care, but we want them also to understand women, listen attentively, and act on it, just to make sure that women's issues are not dismissed. And then the other piece is the governments, right? The policymakers. It's the platforms for accurate, trustful information are the other key stakeholders in this journey. And also the last one, maybe just come to my mind, is one of the top one is the education system, right? We need to have a dramatic change in the education system. We need to teach health at the schools. So once you have all these stakeholders work in harmony, I think then we can truly empower women. I think this is the way to create that ecosystem of empowerment for future.
I love that. Apparently there is a problem with the file, but they are desperately trying to fix that. Nichole, I know this time next year in Cannes, we'll be talking about the impact of this campaign. Could you talk a little bit about what are the goals? Like, what are we collectively hoping to achieve?
Yeah, it's a great question. And I think as the whole ecosystem evolves, we've just launched the web in UK and then we're rolling out into other countries and then social. So there's going to be a lot more as we go. We're only just getting started. I think overall, one of the most important engagement metrics is around how are we reaching women in the first instance, and is our creative connecting? Is it really meaningful? Is it relevant? Is it really driving women to the different sort of areas that we want to kind of send them to get the heavier lift on the education piece? So is the campaign doing the work to feed the ecosystem with the women that we need to speak to and bring in to the conversation? And then I think once they're there, how are they interacting with the information? I think if we're keeping our finger on the pulse of this, we can pivot and change and adapt the content as we go, as we learn. And of course, every woman is going to look for something different out of the experience. And I think that's one of the things that's very intentional from the get-go, is to help different situations come forward with women sharing their stories so that other women can say, I see myself in that. Okay, that's something that I struggle with as well. And so the deeper we pull them into the content, the more educated they're going to be. So again, just understanding how they're interacting with all of that is going to be key for us to measure, learn as we go, and then sort of pivot where necessary.
Jess, I'd love to bring you back into the conversation now. How would you see this playing out on Reddit?
Yes, thank you. And Burcak, I just agree so much with everything you just said. The role that I believe that the Reddit conversations can play is that even though these conversations are really vulnerable, honest, like deeply personal conversations, surrounded by people like-minded, anyone on earth can read them. Right? You don't have to be a woman to go into r/menopause and read. You don't have to be a woman to go into r/women's health and understand what the topic is. I was actually giving this speech last night to a group of men, and one of them said to me, I really wish I had known about r/menopause when my mom was going through it. It would have helped us all, really understand what was happening. But I think the fact that these conversations are happening and they're growing exponentially. Like Reddit as a platform is 20 years old, and we're seeing women's health grow exponentially. We're seeing topics like menopause, like perimenopause, like IBS, like vaginal health. They're growing over 100% year over year on the amount of mentions. It shows it shows the need. So, beyond women, like, we do need the men to get involved. We need them to understand what is happening and what should they, their loved ones, like, it matters to them. The doctors, we find actually that patients get a lot of preparation from reading the conversations on Reddit, but I think it can work vice versa. Doctors can read what is going on in these patient-centric conversations, and they could be more prepared to have quality conversations, similar to policymakers. So I think just getting more eyes on the conversation, recognizing the growth, like which conditions are really spiking, shows a real need for more support. I think that can get us to, more research, hopefully more funding, better policies. I think we just need more eyes on what these people are telling us.
Right, and that's going to drive the systematic change that we need.
Just to add on, you said it very well, like there are lots of things to be done for the R&D research, the funding, because we say women's healthcare is under-prioritized, under-studied, under-invested, right? Just a number regarding to that, we know that only 4% of healthcare R&D investments are on women's healthcare, except reproductive health. So it's a dramatic number. There is a big things to be done in terms of we really need to have quite good level of investments for the conditions which affects women differently and disproportionately. What does that mean? We should also think women's healthcare is not only reproductive health, right? It's sort of a holistic well-being of women should be in the focus. What does that mean? For example, again, menopause is the topic that I would like to give an example. When you go to the doctor, you just say hot flushes, but it's not just hot flush, right? It's beyond. Doctors, the HCPs, should also come up with the system that should see the women's healthcare holistically. It should make the connection of during the menopause, how it affects the cardiovascular health, how it affects the bone health, how it affects the mental health and the total well-being. So these are the quite big changes that we need to have in the healthcare system. And also the clinicals, for example, when we look at it, we don't see any women, right? I mean, they are underrepresented, so that our physiology is not in the clinical trials, but we are getting the prescriptions based on the clinicals. So in that sense, we just don't need tweaks. We really need a transformation in the healthcare system, unfortunately.
Can I just say one more thing that Nichole, you said earlier also about brands getting involved? I think that really resonated too, because I think that's such a quick, but like it's a connective way for brands to speak directly back in the conversations, right? All these conversations are happening. There's clear demand. Brands are the experts, and we have research that shows that like people on our platform, the millions and millions of people, they do want to hear from the experts so they can lend their expertise and really drive so much value and education and knowledge.
Yeah, I think as well with brands, I think driving consumer advocacy and empowerment of taking care of oneself and knowing what's right for you is in addition to helping educate physicians. We see a lot of great brands like Bayer have strong relationships with healthcare professionals, well established. So there's an enormous amount, with all the work that has to be done, there's an enormous role for brands to play. I think it's a great point.
Well, I think with that, we are at time. So I'm going to ask each of you, perhaps if you were to leave one message with this audience, what would it be? Jess, do you want to kick us off?
Ooh, one message. I think it's just that regardless if you're familiar with the product, you care about your health journey. You have loved ones that you care about their health journey. And I think you can seek a lot of support from people who are knowledgeable in communities, right? And the health communities on Reddit. So I think no matter what you're going through or your personal journeys or people around you, there are others that are going through the same, and you can feel less alone by connecting with these communities on Reddit.
Yeah. I think that's great. I think for me it would be every woman has a community in her life. And I think, opening up the dialogue with friends and, encouraging women to understand their health better, go to trusted resources, seek out help if they're struggling. let's talk. Let's open up the dialogue. I think for so long, women's health has been suppressed by stigma, taboo. It's been something we're not allowed to talk about, and it's been very discouraged, up till now. And it's so exciting to see that getting lifted. So let's give that, energy. Let's really fuel that, and hopefully we can turn this around.
Super. And my last word is this call to action to all these nice ladies and also the partners of these ladies. I mean, really, if any issue, any women's healthcare issue holds you back, go and act on it. You shouldn't accept it. You should just face with it to understand. Go to the right person. Go to your doctor. Go and discuss it and speak up, and voice your concerns, your needs freely, so that then take your solution and make sure that you're on top of your best game and deal with your problems. So this is basically the message I want to say. Don't let it get you down. Just be on top of your game. Thank you.
Well, I think with that, that's a wrap. Thank you so much, everyone.
Thanks.
No, I just want to say thank you to everybody for coming and hearing about what's happening in health with women. Unfortunately, the video, there was some corruption in there. So, Burcak, just want to ask you, and Nichole, where can people go to see? It's such a beautiful, beautiful piece of work. I just want to make sure people know where to go to find it. So,
through the website, it's woman.bayer.com. Thank you.
I think any woman who sees this piece of work, or any man in many ways, can really relate to I think I can relate to like 4 of the 5 women in there, and I'm sure many people in the room feel the same way. So thank you for investing the time, the energy, the resources, the smarts, because those are the kind of pieces of work that are going to change the world for women, and we need more and more and more of those. So thank you for your passion and your diligence and everything you guys have done. And thanks, Jess and Michelle. Always love to have you hanging around, and you did a wonderful job. And thanks, everybody. Hopefully we'll see you next year. But if not next year, well, next year, plus some of the other meetings that World Women Foundation does. So thanks.
Thank you, Wendy.
Oh, wait, hold on. We can get the video. What is it? Oh, let them smile first. I have to wait for them. I think we can actually get the video up if everyone wants to spend 2 seconds. It's really worth it. What's the name of the website? Woman.buyer.com. All right, give us 1 minute. It's always dangerous when I play the role of a technology lead. I'll go. Oh. Okay, here it is. Yep. And the volume. Make sure the volume's up, please. Please make sure the volume's up.
Every single month, blood. So much blood. The lost moments, the sacrifices I've made. Is this heavy period normal?
I've been told it's common in menopause, but my whole body's on fire. Dripping sweat. The sleepless nights, ups and downs. Is it normal I suffer in silence?
The desire's gone, vanished. The growing distance, feeling sad, guilty. Is this quiet battle normal?
Every time we get too close, the anxiety hits. What if I get pregnant? Is this fear normal?
With every period, the cramps, the agony, I'm the one who misses out, can't be there. Again, is this unbearable pain normal?
You know what hurts in women's health? Being told everything is normal. Because if something is holding us back, it's anything but normal. It's time to question what we've been told and confront what we've accepted. It's time to reclaim the moments we've missed. Women by Bayer is here to reveal what's not normal in women's health. Raise your voice and share your story at women.bayer.com. Together, we can create a life without compromise and embrace every single moment.
I guess that's what we call the pièce de résistance. Thank you for letting it be the finale. So thank you all. And thanks everybody for coming.